A medical study in Mumbai, India, has found that more than half of the city's slum residents have been infected by COVID-19. 65% of the city's population live in slum areas. Overall, the study also found 1 in 6 of Mumbai's residents are infected. The survey results come a week after a similar study suggested that almost a quarter of New Delhi residents are infected with coronavirus. Rebecca Bundan joins us from Mumbai tonight. Rebecca, Mumbai has a population of about 12 million. If these medical results are anything to go by, is that a signal that India's official case numbers are vastly underreported?
Well, certainly medical experts have been saying for some time that the numbers we're seeing coming through officially from India in terms of the number of confirmed coronavirus infections is significantly lower than the actual number of infections in the country. And that's largely because the rate of testing is still relatively low in the country. It's still much, much lower than it could be. And that's been a factor, although India has increased the amount of testing that it's doing and is continuing to increase the amount of testing. Also, there have been some questions about whether all the data is going through into these numbers as well. But the findings of this latest study from Mumbai are extremely interesting, showing that 57% of those people sampled in the slum areas were infected. This survey looked at 7,000 samples, and it looked at 3 areas of the city. So certainly it doesn't give us the full picture as such, but it certainly shows a lot of interesting information. And that was what was expected, was that the virus would spread very rapidly in slum areas, because you do have these heavily overcrowded areas in the city where you have tiny houses, sometimes 10 people living together in a very, very cramped space, these narrow little lanes. Hygiene is also very, very poor in the slum areas as well. That sometimes the toilets are shared by dozens of people. So it was expected that the virus would spread rapidly, although these numbers are considered higher than some would have expected. And also those numbers showing that 1 in 6 outside of the slum areas are potentially infected, and that they had the antibodies suggesting that they may have been infected with the coronavirus already.
Rebecca, tell us more about these serological tests. What else are they useful for?
Yes, certainly this information, the numbers that have come through, are being looked at very, very closely, especially following the Delhi survey as well, which showed that almost 25% of the population may have been infected in that area as well. So these numbers are taken seriously, and they can show a potential trajectory, the pattern of the spread of the virus as well. So interestingly, Mumbai is now actually looking at conducting a similar sample test next month as well, and it will be interesting to see how what numbers come through in that. And authorities would also look at these numbers to see what kind of action they need to be taking at this point in time, what kind of restrictions need to be put in place. For example, if these numbers, as they're showing, 1 in 6 people outside of slum areas may not have already been infected, it does tell us that there is still a large number of people that have the potential to be infected with the coronavirus. So what happens when Mumbai opens up even further? At the moment, a lot of the city is still shut down, but what happens when people start travelling around the city more, when restaurants open up to customers and so on, which is something that hasn't happened yet. So that's certainly something that's going to be looked at very closely. Also, the numbers we've seen coming through from Mumbai have actually been coming down, although the wider state of Maharashtra and of course India's figures overall have been increasing quite rapidly. The Mumbai figures, for example, on Tuesday were reported at some 700 new coronavirus cases, but that's actually half of the daily cases that we were seeing in Mumbai a few weeks ago. So that's another reason why these numbers will be studied, particularly as more such surveys are done and more information actually comes through.
Many thanks for that, Rebecca Bundan, speaking to us from Mumbai.